Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Jamie Babcock. She's a healthcare executive. Today's KevinMD article is Interdisciplinary Care Teams Play a Pivotal Role in Mitigating the Clinician Shortage. Jamie, welcome to the show.
Hi, thanks so much for having me. Glad to be here with you.
So let's start by briefly sharing your story and journey.
Sure, yeah, thanks. So I've been in the healthcare space for almost 20 years, and so it's been a lot of fun to see that evolve. Started as an RN, and I'm a licensed adult nurse practitioner, but I've been in more of the clinical ops space here for the last 10 years or so, and I spent some time at Optum in their ISNP space, which was great. I love that population and really got my passion going behind the elderly, the complex, the aging population. I mean, they're just a really underserved, underutilized, a group of people that need our help. And I really fell in love with that population. And I was there for a long time, had a great experience, and I joined my Laurel here about 6 months ago to lead their clinical operations and care services, providing, acute care in the home and again serving that population of the elderly and the frail, the complex. And here I am today. It's kind of been a whirlwind of a little bit of everything, but it's
All right.
it's been great. It's been a lot of fun.
All right, so let's talk about your KevinMD article. Interested in hearing your perspective from the worldview of industry. Interdisciplinary care teams play a pivotal role in mitigating the clinician shortage. Now, for those of you who get a chance to read that article, tell us what it's about.
Yeah, we've really, I think, as especially coming out of COVID, right? We've all seen these shortages in healthcare, and kind of led all of us to look at how do we mitigate this? There's not going to be enough nurses. We know that the physician shortage is very real. We see a paramedic shortage that's very real, and it spans across all of us. So how do we all work together, and how do we get each other practicing at the top of your licensure so that we can fill these gaps?
Yeah.
I think we spend a lot of time saying, oh, well, a nurse can do this part and a paramedic can do this part, but don't cross. And I think as a society, a culture, we have to evolve, and it is going to take all the pieces of the puzzle to fill the gaps that we're seeing in healthcare right now. And I think that includes our EMTs, our paramedics, our nurses, LPNs, RNs. We need everyone coming to the table, and it's really just looking at how do we come to the table, build this team where we all have a piece of it. And we have to make sure we're not another fragmentation of the healthcare system where we say, yep, nurse can do this, paramedic does this, we're not going to blend. We have to. And I think it's where we have to get as a culture from a healthcare perspective, and just in our ecosystem, right, of utilizing all of the resources to meet these patients where they are. Unfortunately, I think we see a lot of times people end up in the ED unnecessarily because, well, paramedic can't do that in the home,
Mhm.
a nurse can't do that in the home, or something like that. And it's like we've got to tear down these barriers. That's how I think we're going to solve this shortage. And really, it's where a lot of my passion lies, especially as I see these patients that are, elderly and frail. They don't need to be in the ED, and it's not where they need to be treated. And, I think getting everyone at the table and all the disciplines at the table, that's how we move the needle in closing the gaps in healthcare.
Yeah, so before we talk about some of those solutions, just give us some context. Why is healthcare so siloed in the first place? What are some of the reasons behind that?
Mhm. I think that's such a good question. And it's one I've been diving into a lot. And I think it's unfortunately, we are sometimes there's a politically charged agenda behind things. It's part of how things have come. There's a lot of money and dollars, and healthcare has a lot of monies and dollars that are just flowing in and out. And when we had the staff and we had an abundance of nurses and all of those things, it wasn't as big of an issue. But now we start to see, there's a nurse association here, or a paramedic, or a physician, and it's like we really got to tear that down, and we can't segregate ourselves. We need to be one healthcare ecosystem that we're pulling our resources depending on where those patients are at. And I think it's going to take a lot of lobbying. I think it's going to take a lot of advocacy, painting this picture, the broader picture of how we all fit in here together. There is enough to do for every
Yeah.
discipline, right? And I think we've just let ourselves get really like, well, we're nurses and we're home health and we're this. And we've got to tear that down. There needs to be a lot of advocacy, to tear it down, and where we are just one big ecosystem that works together.
So tell us an example or a story where one of the frail members of our society, someone with chronic diseases, someone who is elderly, ended up in the emergency department because of that silo? What would that look like? What's an example of that?
Yeah, I think, we see it in a lot of different states have different regulations, but there's some states where nurses can't provide a certain level of care in the home because it's just a regulation that's in place. So that instead of being able to treat a patient there and maybe do a hands-on assessment, which sometimes they can't even do a hands-on assessment in the home, they're going to have to go to the ED. You find out it's really, it's a, let's just say, a basic pneumonia that could be treated
Hmm.
with a antibiotic or something,
Yeah.
but they end up in the ED and they sit there for hours. There's times where, paramedics are just incredibly smart. They're highly trained. They know sick. And there's times they get in a home and their hands are tied. If they can't take, let's just say they can't take an order from a nurse practitioner or a physician's associate, right? They can't, it's a regulation they can't. So their hands are tied. And because of that, we're sending that patient to the ED.
Hmm.
And it's unfortunate. It's almost like a self-imposed, right, from a cultural societal perspective, that we put these regulations in place that tie the hands of these wonderful, highly trained professionals just because of regulation.
So tell us your vision. What would that interdisciplinary care team, what would that look like if you ran our healthcare system?
Yeah. I don't know if we have enough time for this, Kevin, but so my vision, what I would love is we take down the barriers around all of these disciplines. And we know obviously, paramedics are trained one way and physicians are trained one way, and we all have a space in it, but there has to be a place where we all work together. And if a paramedic is in a home or home health is there with an RN, they need to be able to help coordinate and quarterback that care without there being stipulations on, up, you cross this border, you can't take an order from, a physician associate, but next door you can. So we need to tear it down. I think we've just let ourselves get way too segmented, and those are the pieces that have to come down. And I like the associations of, because nursing has a specific practice that they follow, and physicians and things like that. But at the end of the day, there needs to be one healthcare, and here's how we're all working, and those all roll up into the same system. Right now, it almost feels like, nurses roll up over here and physicians roll up here, NPs roll up here, and it needs to roll up into one big hierarchy where we're all working together, and have our specialties, and just utilizing those, their precious resources that we don't have enough of. Let's use them all to top of their licensure.
Now, is it purely a matter of regulation? If
Mhm.
politically we can remove some of these regulations that prevents people from operating at top of their licenses, would a lot of the obstacles that we mentioned, would they go away?
I think a lot of them would go away, right? Removing some of these obstacles and regulations within the states, I do. I think it would have to be a big cultural shift, because we've went on this road for so long and down this path, and it would have to be almost unwinding it and retraining ourselves how to think differently about the healthcare system and the ecosystem of resources that we have at our fingertips. So, talk about change management, right? It would be a pretty big change management lift, but truly we've got all of these resources, and how do we all use them to work in the right scope and practice? And I think it does start with taking down the barriers of, whether it's, you know who they can take orders from, independent practice, whatever that might be. But that would be step one, is how we start, and really opening up the doors, so everyone, it's about being at the top of your licensure, right, and having that across all the states. Just because you live somewhere and we have a different regulation here, that's unfortunate, right, that you don't receive the same level of care or can't access that. So I think that's where we'd start.
So, in your advocacy to remove some of these regulations, are you encountering any pushback from these individual organizations that prefer the status quo?
Oh yes. I think, healthcare is interesting, right? There's I think two parts of it. There's part of it that's, it's very fundamental. It's very, I hate to say old school, but kind of
Yeah.
set in our ways. Like, this is how we've done it. We're going to keep doing it. And the thing is, healthcare has changed so much. You could even just say in 5 years with COVID, healthcare
Yeah.
has changed so much that we have got to evolve. And I think that's where we're still stuck a little bit. We need to look forward, right? What does 5 years, 10 years look like? And that's what we need to be working on now. So when you start putting these ideas out there, there's a little bit of like, ooh, that's not what we do. That's not how we've done it. And you're right, it's not. But we've got some major changes to make to move this forward and ensure we're in good shape when you and I need care when we're
Mhm.
older. we have a lot of work to do. So I think, we talk about change management. It's about, getting people out of the today and starting to look at 5, 10 years down the road. And what do we need to do today to be prepared for tomorrow? And it starts with like really seeing this big picture and, understanding there is room for all of us at the table. Expanding the scope of, a paramedic or an NP isn't going to impede anything that, another discipline might be doing. It's actually freeing you up to practice the top of your licensure, right? So it's like going to be a lot of change management, I think, and seeing this bigger picture of
Mhm.
getting out of the today space or, well, that's how we did it yesterday. Like we're in a very different world, right, than we were yesterday.
Now, you mentioned home-based care a few times. Tell us how home-based care can alleviate some of the clinician shortages that we're seeing.
Yeah. I think home-based care, it's interesting, home-based care, you can do so much in the home.
Yeah.
There's so much, I mean, with technology, I mean, there's just, and it's another evolution piece, right? Where, 10 years ago, we couldn't do point of care labs like we do today. Like now you can get point of care, you can
Yeah.
do ultrasound and EK, I mean, everything point of care, and you can treat patients where they are. And think about it, they're comfortable, their family is there, you actually get to see their home environment. The things you learn about being in someone's home and identifying really the root causes of what sends them to ED is just that experience alone is second to none. Those are things you don't learn when they're in the ED, and you find out that they only take their Lasix when they can get to the kitchen and get the
Mm.
bottle off. It's just little things you pick up on. So I just think that the home-based care, a lot of care can be provided there, and it prevents those patients from going to the emergency department, or people that they're coming in with heart attacks and strokes and things that are really serious and time sensitive. They can get that care more timely if we can keep these patients at home that really are more stable. Can be treated there. I think there's a lot to be done. You see it, right? Hospital at home, you're
Yeah.
starting to get that rolling. Like that's got a lot of attention, and it's because you can do so much in the home. And where we come in and providing acute care in the home, you can treat a lot of things in the home. You can give a liter of fluids or IV antibiotics or Lasix or something like that. That sometimes that's all they need. You get in the hospital and you sit there for 9 to 12 hours in the ED, and
Yeah.
that doesn't work. So I think it's a huge opportunity, and really where we have to drive. But again, it's removing some of those barriers from like our licensure of different disciplines to really be able to do that and implement it everywhere. Right.
So why don't you paint a picture for us? So let's go back to that scenario we were talked about earlier, where that patient had to go to the emergency department because of our siloed healthcare system.
Mhm.
Now let's shift that scenario and tell us about your ideal scenario where we have an interdisciplinary team
Yeah.
like you describe. What
Yeah.
would that look like in that scenario, just from a practical basis?
Yeah. I mean, ideal, take everything apart. What would be ideal is you get a paramedic in that home that knows how to assess acuity very quickly.
Hmm.
They know sick. You can telehealth in a physician, whether that's an ER physician, a hospitalist, an internist, whatever their discipline might be. Telehealth them in, and you can quickly, and with all of the technology today too, right? They can plug in and get heart tones and lung sounds and do all of that there. That physician should be able to give an order to a paramedic that yes, they absolutely need, a dose of Lasix or steroids or whatever it might be. We can set that patient up, they're good to go, they're stable, and then I can send an RN out the next day to do a physical assessment, hands-on assessment. We know they're stabilized, we know what their plan of care is. If we need to change it, let's telehealth the doctor back in with that RN, and we can treat that patient again if we need to. But it's almost like that paramedic comes in and helps stabilize, does that high level assessment. Physician comes in,
Hmm.
RN comes in, and then we can get them into a telephonic phase where we can follow them. And if we need to pull in social work, I think social work is terribly underutilized, in this space, especially with the SDOH gaps that we see. So bring in social work, but it just gets all these disciplines. And at the end of the day, you're going to look and you'll say, we've had a paramedic, we've had an RN, we've had a social worker, a physician, you know, all involved in this care, being able to treat them in home, and they're safe, it's effective, and we kept them there. But it really has to happen when you can have all of those disciplines working together. Because right now, there's some fragmentation there.
We're talking to Jamie Babcock. She's a healthcare executive. Today's KevinMD article is Interdisciplinary Care Teams Play a Pivotal Role in Mitigating the Clinician Shortage.
Mhm.
Jamie, will end with some of your take-home messages that you want to leave with the KevinMD audience.
Yeah. I would just say, we all have such a platform and we all have, I feel a responsibility to our patients. And, I hope someone advocates for us, when we get there, and advocating for those patients that can't advocate for themselves. And, how do we put them first and put, whether it's politics and regulations, we have to put that stuff aside and really think about the patients and how do we drive the greater vision of healthcare. And, I ask, if you have a platform and you have a way, you use your voice, and those patients that we serve usually don't have the voice that we do, and we have the opportunity to disrupt, the patterns that we're seeing in healthcare, and how do we, better utilize our resources, and without the politics involved and all the regulations. But I think the biggest thing is just use your voice,
Mhm.
and advocate for those that can't advocate for themselves. And we all know what needs to be done. It just is going to take a big push from a lot of us to make it happen. But I think we can do it. I think we're going to have to do it as we continue to move forward, and really think about what 5 years, 10 years look like, for us.
Jamie, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Yeah, thanks for having me. It's a pleasure.